Hi, my name is Jennie Ren. I'm a family nurse practitioner student at Eastern Kentucky University. Today I'm here and excited to tell you about my project proposal for screening and treating adult patients with prehypertension and hypertension. The reason I chose hypertension is because it is a major national health problem and because it is something advanced practice nurses will encounter often in primary care or community health settings. Per the Centers for Disease Control and Prevention, nearly half of the adults in the United States have high blood pressure, which is defined as a blood pressure above 130/80, or they are currently medicated for it. High blood pressure is listed as a key contributor to heart disease, which is the leading cause of death in the United States. In 2018, hypertension was listed as a primary or contributing cause of death for about 500 million people in the United States, costing approximately $131 billion each year. Due to the severity of this problem, two Healthy People 2030 objectives were formed that are directly related to hypertension. These include A, to increase control of high blood pressure in adults, and B, to reduce the proportion of adults with high blood pressure. The theoretical framework I chose for application to this project is the Schuler Nurse Practitioner Practice Model, or SNPPM. The SNPPM formulates a standard of practice that encompasses assessing patients holistically, developing a treatment plan that is mutually agreeable and self-care oriented, and includes disease prevention and health promotion. The model also considers non-pharmacological interventions and is meant to operate within a multidisciplinary team. Overall, it aims to improve patient and nurse practitioners' personal movement towards enhanced wellness. The PICO used to guide the research for my intervention was, in adult patients diagnosed with prehypertension and hypertension, how do lifestyle modifications, including diet and physical activity, compared to standard treatment, decrease blood pressure over a period of 3 months? After extensive research, 3 articles were chosen: a Level 1 network meta-analysis, a Level 2 randomized controlled trial, and a Level 6 qualitative study. The Level 1 network meta-analysis was a 12-week study with a goal to evaluate the comparative effectiveness of 22 different interventions for lowering blood pressure in prehypertensive and hypertensive patients. Results concluded that dietary approaches to stop hypertension, known as the DASH diet, and both the DASH diet and physical activity are superior to standard treatment in lowering both systolic and diastolic blood pressures. It was actually shown that the DASH diet was superior to all other non-pharmacological treatments in treating hypertension. The Level 2 evidence was a randomized controlled trial lasting 8 weeks. The aim was to evaluate the effectiveness of home-based lifestyle modification interventions, including either diet education alone or both diet and physical exercise education on blood pressure management. The analysis of 24-hour ambulatory blood pressure measurements showed a significant decrease in both systolic and diastolic blood pressure in both the diet and exercise group compared to the control group. It was concluded that both diet and physical exercise interventions are needed to effectively manage blood pressure, particularly over just dietary education alone. A Level 6 or qualitative study was analyzed. Interviews were conducted with patients and providers, and office appointments were observed for up to 6 appointments per patient. The goal of the study was to learn how to better support shared decision-making in the treatment of hypertension. From this study, 4 themes were reported, including poor understanding of hypertension and treatment, perceived lack of choice, limited opportunities for patient involvement in decision-making, and distributed decisions, which is decisions evolving across multiple encounters involving multiple different clinicians. Evidence proved the need for increased education, more treatment options, and enhanced shared decision-making between providers and their patients. Adding dietary modifications and increasing physical activity was statistically proven to lower both systolic and diastolic blood pressures over usual care. Because of this evidence, I am recommending the addition of these interventions to standard care in a primary care setting. The first step in project implementation is to identify and recruit stakeholders. These would include providers, administrators, office staff, patient, and patient family members. An initial meeting will occur where roles are assigned and staff is educated. Then education material will need to be made. This includes a hypertension education page, dietary and physical activity education sheets, and goal sheets with areas for individualization of treatment. Screening will be done by obtaining blood pressures on all adult patients at office appointments. When patients meet criteria, providers will offer the project information. The next step will be to provide education to the patient and family members and to formulate specific goals. Follow-up appointments are based on clinical need, but no later than 3 months. If resources allow it, patients can even be provided with a home blood pressure cuff and notebook to track their home blood pressures. If not, they can be referred to where to purchase one and told to document their home blood pressures. Home and office blood pressure measurements will be reviewed with patients at each office appointment. Final blood pressure comparison results and patients' perceptions of the project will be reviewed every 3 months. Dissemination of results to staff and stakeholders will occur during meetings, over Zoom or via email, and adjustments made to office processes and role allocation as needed. As far as the timeline goes, the planning phase, which is recruiting and educating staff, formulating patient materials, assigning roles, and marketing to patients, will be lasting 0 to 3 weeks. Meetings will be held weekly for 1 month, then scheduled based on staff need. Implementation will occur over 3 months for each patient. Results are assessed at 3 months and treatments adjusted as needed with ongoing follow-up continued. Staff and stakeholders should be updated on patient outcomes, initially at the 4 to 4.5 month mark, then quarterly. Outcomes will be evaluated based on the comparison of systolic and diastolic blood pressures prior to the addition of the interventions, so at baseline, during the proposed 3-month intervention period, if patients are being seen in the office, and at the end of 3 months. Patients' perceptions of the project and feelings toward their blood pressure management will also be assessed at that 3-month mark and with every appointment. In conclusion, implementing this project provides patients with an evidence-based treatment option proven to decrease blood pressure. In addition, dietary modifications and physical activity will provide other health and wellness benefits besides just blood pressure management. I hope you enjoyed my project proposal and find it helpful to your future practice. Please see the attached references for a more in-depth review of the literature. Thank you for your time.